Good morning. I want to welcome you to our Friday press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. We will now hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. Good morning. I'd like to begin. Recent had a situation. Two cousins of mine, both 64, 65, contracted COVID at the same time. Both of these fellows in good health. Neither one was vaccinated. They had a meal together at a restaurant. Pretty sure that they both were infected on that occasion. One of my cousins had the wherewithal, after he developed the symptoms, to have this monoclonal infusion therapy. He was sick, but he did not require hospitalization. My other cousin, who lives alone, did not seek medical attention until his symptoms were in an advanced stage. He passed away last week. All that being said, I would, again, I'm sure Dr. Black's going to tell us something about it, but this infusion therapy is an option for individuals who become ill. As soon as you have the symptoms, we are aware that this treatment has a very high rate of preventing patients from becoming seriously ill and needing to be hospitalized. We have some numbers here. I'll share them with you like we did last week. These testing results come from our city manager. And I talked to Mr. Carter. I said, well, would you give me the numbers? And he explained to me, well, we don't have the numbers yet. He explained we don't have the numbers yet because the next 14 days hadn't passed. And I didn't understand the significance of that till we got the numbers. So I want to caution you, even though it says biweekly test results, these numbers are only through August 26. The 14-day period would actually be through August 30th. But you see here the number of tests in blue have been skyrocketing in the month of August, and the percentage of positive results, as we saw last week, continues to climb. Now, again, what is interesting, we start looking at July 12th. That's when the numbers start going up, and as we know, 10 to 14 days after a holiday, we've seen it time and time again. But there's also a situation here that we as a community and throughout the country, people become more and more complacent as, quite frankly, I think by the middle of last June, when we suspended these task force press conferences, we thought that this thing was pretty much in the rearview mirror. That is not the case. Next here, we have the test results. These numbers are kind of small. We probably should have done them in biweekly. But as you see, from August 16th to August 23rd, the positivity rate remained at 21%, which is as high as it has been since April of 2020. What is important again is we only have this last week, the number of tests you see continue to increase. The positivity rate, as we have stated time and time again, is one of the indicators of the spread of the virus in the community. The others being the census of the hospital, another being the 14-day rolling rate, and another Mr. Allen has referenced is the number of transports we have from Dougherty EMS. We learned this week that recently Dougherty EMS has been transporting an average of 9 COVID patients a day, which again is the highest rate we've seen since April 2020. The next graph here is again showing us the positivity rate. We're still at 21%. One thing I discovered that any change over a reporting period of more than 4% is a significant development. That's whether it's 4% down or 4% up. And here, what you see, if you look, this is interesting, between July 12th and July 19th, you had an increase of 8% in 1 week. Again, we can trace that back to July 4th and people becoming less compliant with the safety precautions. Following that increase of 8%, you have another increase of 8%. So over a reporting period, you actually had an increase from positivity rate from 5 to 21%, which is quite significant over such a short period of time. And I want to thank Mr. Carter for providing the information on the testing results. The next reports, I'll go through these quickly. These are Phoebe Putney's, as we say, the whole system. Here again, the census I talked about last week, it was 108 the week before, and I said last week there's every indication that the census will be higher this week. As you see, that's true, and we'll see the number, which I believe, again, is the highest census you've seen since April of 2020. Inpatient county of residence, we note that some of our rural counties with a very small populations of under 10,000, have had significant increases in the last few weeks. The racial breakup is less significant than it was in the past. You see 51% African American, 45% Caucasian, and these are the patients who are admitted to the hospital, not people who are testing positive, female more than male. Age group, this is something we've talked about. The people at Phoebe, I want to express my appreciation. I suggested that we get a graph showing the percentage of patients by age band to establish what we have been saying in recent weeks, and that is the number of younger patients represents a higher and higher percentage of those being admitted. We can look, and this orange column is since July 15th, 2021. So in approximately 5 weeks, we see that the number of patients being admitted from the ages of 20 to 60 has increased significantly. This is important for several reasons. One is we're going to see in a minute with the number of people who've been vaccinated, those individuals who are 60 and older are more inclined to be vaccinated than younger adults. We know that. Age group, percentage of total. This is a better description of what, or illustration of what's happening. You'll see that the percentage of patients being admitted to the hospital, and this graph could be better. The blue column should have spread out to the from March 1st, 2020 to July 14th, and the contrast would be even more dramatic. But what you're seeing here is the patients who are 60 and older are representing a lower percentage, and the patients who are under 60 are representing a higher percentage of those who are being admitted. And obviously, if someone's being admitted to the hospital, they are rather seriously ill. This breaks it down to our 2 local hospitals. COVID census by week, as I said last week, when it was 108, We expected the number to go up. It went up significantly more than anticipated. The census for the week ending August 21 was 146. That means there was an average of 146 patients in the hospital during the 7 days leading up to August 21st. This is obviously the highest census since April of 2020, and it might be the highest census since the pandemic began. Admissions by week, Dr. Hudson, Dr. Black, Dr. Lewis, it's been repeatedly explained that the number of patients being admitted who are unvaccinated is the overwhelming majority. I think in the front page of the paper the last few weeks, Phoebe has been putting up a ad, and I think most recently 83% of the patients who are in the hospital were unvaccinated. This graph is going back to early April when the vaccine was first available and shows you the number of patients admitted each week. The red indicates those who have been vaccinated. And as you see, the number went up significantly with this most recent surge, and the scholars will use that word attenuated. Apparently the immunity of patients who have been vaccinated declines or becomes over time, and maybe we're seeing some of that. Vaccination numbers, this is interesting. If you look at this, the graph, the two numbers on the left represent the state percentages. The two numbers on the right represent Dougherty County. As you see, Dougherty County has trailed the state since the vaccine was first available. It's interesting here, what you want to see is a difference of about 5% between the number of people who are partially vaccinated and fully vaccinated. And that is because what it's showing you is people are actively seeking the vaccination. Unfortunately, I don't have the numbers from June because we didn't meet in June. These are numbers that Dr. Lewis gives us, but you will see that there has been an uptick. I think the numbers sort of flatlined. There was a general positive response in the early days of the vaccine. As you remember, you used to have to make an appointment. Phoebe had a vaccination site. The state brought down a mass vaccination site, and there was not the demand, unfortunately. What we have here is a recent increase, and I believe it is attributed primarily to this recent surge and the realization of young adults that they too can become seriously ill if they are not vaccinated. The numbers for the state just this last week reached 50% of being partially vaccinated. Here in Dougherty County, that number is 44%, and as you know, the goal of the Strive for 75 campaign is to increase that number to 75. Lastly, the percentage by age range. This is a very telling story. I mean, this is a very telling graph because obviously what it shows us is people who know they can become seriously ill or have been vaccinated. Almost 95% of Dougherty County's population, 65 and older, have been vaccinated. Here are the numbers, ladies and gentlemen, and you see the dramatic drop from the age band 65 to 74 to the next age band, which is 55 and 64, and it continues in that progression till you get to the age group 15 to 19, which actually has a higher vaccination rate than those that are 20 to 24. But what we're going to have to do is these age bands between 15 and 64, we're going to have to get folks vaccinated. And I just want to, again, tell you that's the best way to stay safe. That's the best way to stay out of the hospital. Thank you.
Thank you, Mr. Mayor, for your comments today and update on the current situation in our community. We will now hear from our representative from Phoebe Putnam Memorial Hospital, Dr. James Black is here. He is the chairman of the emergency department. Dr. Black.
Thank you, Chief. Mayor Doro. So we had another bad day yesterday over at the hospital. We admitted 23 COVID patients just here in Albany. And right now we have a total of 187 patients in our hospital system. That's 152 in Albany, 29 in Americus, and 6 in Sylvester. Now, overall numbers have dropped a little bit. I think last week we topped out at 214 in the system. But don't let that number fool you, or don't let the drop fool you. The number of inpatients went down because we had a couple of days we were able to discharge a large number of patients, but unfortunately we also had a high number of deaths. Since last Friday, 17 patients have died, 17 of our COVID patients have died, and that's our highest weekly total since January. Don't let anybody try to convince you that this surge isn't serious or that COVID isn't deadly. An increase in death usually follows a few weeks after the increase in the hospitalizations, and that's what we're seeing now. While it's true that we're taking care of some elderly folks and plenty of patients who have pre-existing medical conditions, it's also true that we're seeing a lot of healthy people and a lot of young people. We're also, while it's true we're seeing some breakthrough infections, those who are vaccinated, it's also true that the ones who are getting admitted to the hospital overwhelmingly are ones who have not been vaccinated. I think that our percentage of inpatients with COVID, 87% of those have not been vaccinated and 13% have. Here's an example. Wednesday, Phoebe Sumter in Americus admitted 7 COVID patients, which is a pretty high number for that facility. All 7 of those patients were unvaccinated. The oldest patient was 46, the youngest was 22, and 4 of those 7 were in their 30s. Can't stress it enough. You're going to keep hearing us say it. We're going to keep saying it. Vaccination is still your best protection against the virus, and also serious illness resulting from the virus. We're grateful that we've seen a tick up in the demand for the vaccine, but as the mayor pointed out, we're striving to get 75% of the community or more vaccinated if we can. If you haven't been vaccinated, we urge you to do so immediately and protect yourself and protect the people that you care about. They're readily available throughout the community in health department, pharmacies, local health care providers. So vaccine is readily available. And you can also get a vaccination appointment by calling 312-MyMD. That's 229-312-MyMD. You may have seen that we've altered our visitation policy at Phoebe in our facilities, and we know that loved ones are an important part of the patient's recovery, and we don't want to suspend visitation altogether, but we're having to take some steps to try to limit the amount of interaction. And we're still allowing 1 visitor at a time. In order to minimize the number of people coming in and out of the hospital, a patient can only have a total of 2 visitors in a 24-hour period. If you come to visit a patient and then you leave, you will not be allowed to attend until the next day. We're also requiring all our visitors and staff and employees to double mask. That's wearing a cloth mask, a surgical mask covered by a cloth mask. And one of the reasons why we do that is that the surgical mask fits around the face, but then the cloth mask on top of it helps to seal it in better. So just be expected to be asked to come in double masked. We're doing all of these things because the strain appears to be a lot more contagious than previous strains. If you may recall, back at the beginning of the pandemic, the current research showed us that 1 person would, on average, affect around 2 other people. And the Delta variant being a lot more efficient has shown that 1 person is likely to infect 9 other people. So we're asking you to do everything we can to limit that spread. We've also seen a much higher transmission in the school age children. A couple of weeks ago, a large number of the community physicians and a large number of the Phoebe physicians sent an open letter encouraging staff and students to wear masks at school, encourage a mask mandate. But I want to tell you, you don't need a mandate or a law to exercise good common sense and try to protect you and your loved ones. We also have been showing great success with monoclonal antibody infusion. I want to take just a second to kind of address some of the questions that I hear about monoclonal antibody infusion. That is not to be confused with recombinant or plasma from patients who have had the disease. Monoclonal antibody infusion is not a blood product. It is also used for people who are fortunate enough not to be ill enough to be placed inside the hospital. Okay, so typically if you have some mild symptoms and you test positive for COVID, but are well enough to be discharged home, we encourage you to get the monoclonal antibody infusion. And over the last week, we have been able to double our availability in Sumter and quadruple our availability to give this antibody infusion at the Albany Hospital. We're also placing a modular building outside of the emergency department. So we're increasing our availability to give this infusion. This infusion has been shown locally and nationwide to decrease the risk of COVID progressing to a much more serious form of the disease, and also decrease your risk of hospitalization. So if you happen to test positive, you can also self-refer. You can actually call 229-312-MyMD and set up an appointment to get this antibody infusion. If you go to your physician or your nurse practitioner or PA's office and you have a positive test, if they don't recommend it, I want you to ask them for it. Ask them for the referral. If they don't give you the referral, again, call 229-312-MyMD. If you come to the emergency department and you have a positive test, I want to make sure that they ask you and they refer you to get the monoclonal antibody infusion. I think of the first 600 patients that received the infusion, only 3 had a need to be hospitalized subsequent to the antibody infusion. All right, this is a number that's been repeated around the state and around the country. Take advantage of what we have. Last March and April and May and June, we did not have any options to help us keep from getting any sicker. We now have options. We have vaccinations, we have monoclonal antibody infusion, we have a greater knowledge of the role that masking and social distancing and proper care, self-care can do to help reduce your risk of becoming seriously ill from coronavirus. So again, I want you to encourage you to take advantage of the monoclonal antibody infusion. This week, we also received 10 National Guard troops that have been, they've arrived at our main clinic to assist in our COVID response. And our soldiers were a great assistance to our team during our initial stage last year, and we're certainly grateful for the resource provided from the state. We've also seen an increase in the community groups and organizations reaching out to support our healthcare workers, by delivering meals and messages and prayers and holding prayer vigils. And we certainly need your thoughts and prayers and support as we continue this difficult fight, and we greatly appreciate it. Thank you.
Thank you, Dr. Black, for that very informative update from Phoebe Putnam Memorial Hospital. I would like to move now and hear from Public Health, Dr. Charles Ruiz, who is the Director of the Southwest Georgia Health District.
Thank you, Chief. Over the past couple of weeks, on average, 72 people who live in Dougherty County have developed the COVID virus infection. So that's over 1,000 people who live in Dougherty County over the last 2 weeks have become infected. That's a very high rate of infection. And this is a number that's commonly found throughout the state. Over the last couple of weeks, there have been anywhere from 10,000 to 11,000 new infections in the state of Georgia. So we're surrounded by the COVID virus. And as it has been said already, getting a vaccination is the best way to prevent getting the infection. It's the best way to avoid dying from it. One of the trends that we're seeing with this surge is the virus is causing infections in younger people at a higher rate than it ever has before. It's also causing more hospitalizations among young people than it ever has before. So earlier in the pandemic, we tended to think that this was a disease that was far more dangerous for older people, and that's still true. But hopefully we are realizing, if we haven't already, that young people are very much at risk in our community. In the state of Georgia, 50% of Georgians have had at least one vaccination for COVID. Half of the population has decided that vaccines are right for them. In Dougherty County, that number is 44% of people have chosen vaccines. Every day, more and more people in Dougherty County are choosing to get vaccinated for COVID. They're making the wise choice. However, still only 37% of Dougherty County citizens are fully vaccinated, and in the state of Georgia, 43% are fully vaccinated. But every day, that number of unvaccinated people gets smaller and smaller. One way to look at it is there are three groups of people in the state of Georgia and Dougherty County. Those who have already decided that vaccines are a very good thing. They want the vaccine for themselves and for their family as soon as they're eligible. There's another group who is nowhere near that decision. There's a group of folks who seem bound and determined not to get vaccinated. We care about those people, and we want to encourage them to try to look at this with an open mind and to look at the science and to look at what's going on around them in the community. But there's another group of people who are somewhere in the middle. They're not decided. They're looking at the vaccine from different angles. They're trying to make a decision. They're wrestling with it. And we know that because every day people are coming in to get the vaccine who were eligible months ago. And we hear their stories, and they talk to us about the struggle they've had with deciding whether or not to get the vaccine. In some cases, they have legitimate concerns about the science. In some cases, they've heard wild stories about things that are in this vaccine that are not true. In a lot of cases, we're hearing that people were influenced by their friends and family who were strongly opposed to the vaccine, and they feel kind of caught in the middle. Thank goodness many of them every day are deciding to make the wise choice. So if you happen to be in that category, if you can hear me talking today and you're not sure whether the vaccine is right for you or not, maybe one important question to ask yourself is, if you compare vaccinated people with unvaccinated people, which group is more likely to get sick? Which group is more likely to be hospitalized? And finally, if you compare vaccinated people with unvaccinated people, which group is more likely to die? The statistics are clear. The vaccine is not perfect. It doesn't always prevent infections. It doesn't always prevent hospitalizations. And in some cases, vaccinated people will die. But the choice is clear. If you want to do what you can to avoid sickness and death, the vaccine is clearly the way to go. It's readily available. It's free. There are many places in Dougherty County and surrounding areas to get the vaccine. Hospitals, doctor's offices, drugstores. Every county in Georgia has a health department, and every health department is offering all three of the vaccines, the Pfizer, the Moderna, and the Johnson & Johnson. In Dougherty County, you can call the health department at 229-638-6424, and they'll be happy to make an appointment for you to get the vaccine. It's available for everyone age 12 and up. Another thing that's important to talk about is testing. As Mayor Dura mentioned earlier, we're testing more and more people every day. It's especially important for people who are symptomatic. One of the reasons why the virus is spreading is because sick people won't always stay home. If you have symptoms that are consistent with COVID, we need you to stay home, talk to your personal health care provider, and get a test. It's easy to do here in Albany now. Tests are available 7 days a week from 9 a.m. to 6 p.m. over at the Phoebe North location, just off of Palmyra Road. Some of you may be able to see the monitor, and it gives that information. The Department of Public Health has partnered with an organization known as LTS. They are providing the staff and the testing materials, and they also have a laboratory where they are running these tests. So you can just show up if you want to and have the test between 9 a.m. and 6 p.m. However, it'll go a lot quicker for you and for everyone else if you will pre-register, and it's easy to do. One way to do it is to call 844-778-2455. Another way that's probably quicker is to use the QR code that you may be able to see on your screen now. You can scan that, and it'll take you to a place online where you can enter your own information. You're not making an appointment, you're just pre-registering. And you can show up anytime between 9 a.m. and 6 p.m. And another good thing about this is once you're pre-registered, if there's a need for you to ever get a second or third test, then you're already pre-registered. You just show up. You can also use a link that is available, and one way to access that link is to go to the public health website at Southwest Georgia Public Health, and that link is there. So you can pre-register with a link, with a QR code, or a phone call. We hope that you will consider getting the vaccine. If you haven't had it, if you need more information, there are many places to get the facts. You can go online. The CDC is an excellent source for information. You can also call your county health department, and they will be happy to answer any of your questions that you have about the vaccine or COVID infections.
Thank you, Dr. Ruiz, for your update today. We will now hear from our Emergency Services Department. The director is here of the Dougherty County Emergency Medical Services. We're certainly glad to have Sam Allen back with us today to make a presentation to us today. Mr. Allen.
Thank you, Chief. You've heard a lot of information today. Let me tell you, it is true. What the mayor said, what Dr. Black said, what Dr. Ruiz said. The facts are true. Here at Dougherty County Emergency Medical Service, this is a chart that we've been trending since COVID started. And you can see on here that when we get close to a holiday, about 3 weeks out, we have a significant turnaround in COVID cases. It's prevalent. We just came off of July 4th. Now we're looking at another spike. So please understand, this virus is steady in our community, and we've got to do what we can to get rid of it. Here's a graph showing you how from July into August, the cases have increased at Dougherty County EMS. We were running about 1 to 2. We got some days down to 0. We're seeing 9 upwards to 10 patients a day. Please keep in mind, we're extremely busy. So every time we have a COVID patient, we have to bring that ambulance in, take it out of service, decon the ambulance, takes about 12 minutes. We have a reserve ambulance ready to go in case that crew needs to respond on another call, and many times they do. So please look and consider the vaccine because the numbers are here. This is true fact. I want to talk to you about the Delta variant. Dr. Black mentioned this. Previously with COVID, it would spread between the primary person to about 2 people outward. With the Delta variant, now we're looking at upwards to 6 people that it can spread. It's spreading thinner, quicker, and faster. This is why you need to, if you've not taken the vaccine, I strongly ask, do something as simple as go to the cdc.gov website, go to Department of Public Health website, go to the City of Albany, go to Dougherty County, look up the information. There's a program, Strive for 75. Please, if you've not got the vaccine, look up the facts now, because we're getting close to Thanksgiving and we're getting close to Christmas. To take the vaccine, if you take the Pfizer, from the day you take it, it takes 21 days before you can get the second vaccine, and then it takes another good couple of weeks for it to get into your system. Time is getting shorter. Please look up the real facts and find out true information, not what you're reading or being told from social media. You can go to cdc.gov. You can go to the Georgia Department of Public Health website. You can contact the Albany Emergency Management Office, the EOC. Information is available to get you good, solid information on the vaccines that are out there. Primarily, a lot of places you can go to and get the Pfizer or the Moderna. Some places do have the Johnson & Johnson. But I ask you to reconsider if you have not taken it. You take the numbers of admits at the hospital, you're looking at over 200 people. Of those 200 people, 87% are non-vaccinated. Let's turn this around in the community and make it 13% non-vaccinated and 87% that are vaccinated. You will see the hospital admit numbers go way down and keep the hospital so that it's not overloaded. So I ask you again, please look at all options, consider the vaccine, and remember, time is getting short before we get into November, Thanksgiving, and December. Remember how it happened last year? Look at the COVID Delta variant spreading 6 times faster. So please, this is real. Thank you, Chief.
Thank you, Mr. Allen, for being with us today, providing an update from Dougherty County EMS perspective, our first responders responding. And so thank you very much, and invite you to come back again and be with us. We'd like to move to our final presenter, of course, and we'd like to bring up Dougherty County Coroner, Mr. Michael Fowler.
Thank you for all the presenters that have come before me. I'm probably one of the last ones you want to see come into the hospital or even come to your residence. But all of them, I'm just picking back on what they're saying. This thing is serious, more serious than ever. As of August the 27th, we have 305 deaths, residents of Dougherty County that have passed. I mean, and those are the ones that we got confirmed residents of Dougherty County. We still have some waiting on tests. We still have some that we're trying to confirm the residents. But right now it's 305 deaths here in Dougherty County. It's 24 more than from the last press conference that we had before. We had 281. Now we at 305 as of today. You will see we have 164 females. We have 141 males. So people are dying. I want to encourage you to please listen to what's been said today. Please listen, because it's for real. It definitely happened here in Southwest Georgia. Death by race. We have 3 Asian, 4 Latinos. We have 67 white. We have 129 blacks. Death by race and gender. We have 105 black males. We have 125 black females. We have 31 white males, 36 white females, 2 Latino males, 2 Latino females, 2 Asian females, and 1 Asian male. Death by age. We have only had 2 deaths in the 20 and under. We've only had 5 In the age of 30, in the age of 30s. In the age of 40, we have 18. The age of 50, we have 29. In the age of 60, we have 83 deaths. Age of 70, we have 69. Age of 80, we have 68. Age of 90, we have 28. Age of 100 and above, we have 3. Breakdown by zip code, this is North Albany, 31721 and 3107. 31721, we have 45 deaths in that location. 31707, we have 62 deaths in that location. Southwest Albany and the south side, we have 120 deaths from the south side. East Albany, 31705, we have a total of 76 deaths in East Albany. Death per month. We're going back, I want you to reflect back what it was last year, back in March. March, we had 39 deaths last year. In April of last year, 2020, we had 86. May, we had 26. June of 2020, we had 6. You saw the drop down. July, we have 12. That's probably during the 4th of July, start picking back up. August, we have 15. Then September, we dropped down to 6. October, we dropped down to 6. In November, we dropped down to 4. Back in December, during the holidays after Thanksgiving, it went back up to 14 for December. January, after the Christmas holidays, it went up to 42 deaths. February was 17. March, it started dropping again of this year. We had 5 deaths. April, we had 3. May, we had 3. June, we had 2. You saw the decline. July, we only had 2. This month, we had 17 already. That is confirmed. We're still working on stacks, and like I said, the tests and some of the proof of address. 17 for the month of August. We now have the morgue here. The morgue have arrived. We went over there and looked at it. But like I said last week, I don't want to have to put no one loved one in that morgue. So if we do what we need to do, practice social distance, wear a mask, consider the vaccination, I mean, I'm serious. That's something, especially if it be a young person. Kids are going back to school, so much going on, activities are going on in school, football games going on. Wear your mask. I can't help it. Some of your friends may not want to wear it, but wear your mask. Protect yourself. Also, I've been getting numerous of phone calls for us, the funeral funds that's available to help with the ones that have died from COVID-19. When EMS come to your house, we come to the house and the law enforcement. Many times they come in, we ask them questions. Sometimes they know before they get there this person had the virus, have been tested positive. Sometimes they don't. So many times we're going to ask questions. Did your loved one have symptoms? 1 or 2 or 3 of the symptoms that is out there. If they have had symptoms that have not been tested, what we would do, we have EMS to transport it to the morgue, and we have Department of Public Health test for the virus. That way we can inform you that you need to go in quarantine or you need to consider being vaccinated. We need to try to help you, because there are some homes I went in last week, every day last week I had a death. Even this weekend, one day I had 2 deaths. People are definitely dying, and some people know in their house that their loved one had the virus and they're trying to take precaution. But there's some not taking precautions. I go in some houses, they know their loved one had the virus and nobody in the house wearing masks. So that let me know that the virus is still being spread. So you got to take this thing serious. But if you want the funeral funds that's available to help the person that had the virus, that's up to $9,000 that they would give you. If your family member have not been tested and we didn't test for it, many times they call my office asking me, could I put it on there? They said, my loved one had the symptoms. Well, we need to get it documented. If it have not been documented, then it didn't happen. So if you tell me that your loved one had symptoms, then we'll get the person tested to find out did they have COVID. So there are funds available for you. We want to be every assistance that we possibly can to help you. But if you don't get tested and your loved one died, don't ask me, Mr. Fowler, could we get this person tested just to see? No, we asking you to go ahead of time. Dr. Lewis already said there's plenty of sites that you can go get tested, and there's plenty of sites that you can go get the vaccination. Again, consider that. Thank you.
Thank you, Mr. Fowler, for your remarks today. We will pause now for questions from the media or from our social media pages. Okay. All right. Thank you very much. We will, of course, remind you of the Strive for 75 campaign, encouraging you to help our community reach the goal of 75% vaccinated. The slogan that's been used alongside Strive for 75 is do your part, reconsider, get the shot. Hope you consider that. A lot of good information passed on today. Hopefully it's been informative for you. And I want to thank you for being with us today. We will see you again next week here at 10 a.m. for updates on COVID-19. With that, that ends our press briefing for today. Thank you.